Hi, I'm Pat Summeral, and you may recognize me from my NFL broadcast on television. I've been covering professional sports for a lot of years now, and I'm still active today, thanks to the revolutionary world of vision correction. You know, in my job, I had to be able to see the players on the field. I also had stats in front of me at all times, so every angle of vision was important to me. Now, with the Crystalens procedure, I see just as well as I did when I was younger. I'd like to share that with you today and encourage you to ask questions and explore the possibilities of sight with the Crystalens. You'll be happy you did. So let's now take a look at this new technology and see how it works.
Hi, I'm Dr. Katzen, and I'm glad you're taking the time to learn more about your vision. In this video, we will discuss how the eye works and how it changes over time, as well as some of the options available to help you see clearly again.
Whether we're seeing the smiling face of a loved one or a favorite television show, our eyes are our windows to the world. Whether near or far, the young eye can focus on just about any object. But what happens inside the eye to make this possible? As early as the 1930s, Fincham theorized that the eye's natural lens flexes and arches. The purpose of this video is to illustrate this accommodative flexing and arching, which take place in both the natural crystalline lens and in today's accommodative intraocular lenses. As the focus changes from distant to near objects, the ciliary muscles contract, the ciliary fibers slacken, and the crystalline lens becomes more rounded for near vision. This process is known as accommodation. As we get older, however, our eyes lose the ability to accommodate. We may develop cataracts, which cloud the natural lens and can prevent a clear image from forming on the retina.
Today, cataract surgery is one of the safest and most common surgeries, with approximately 3 million procedures performed in the United States each year. After we remove your cataract, it is replaced with an artificial lens called an intraocular lens implant, or IOL. It is important for you to understand that you now have a choice to make regarding the type of lens you will receive. Standard monofocal IOLs have been widely used for the last 3 decades and generally provide excellent distance vision. But because they do not move or change shape, patients who receive these standard IOLs will likely require some type of spectacle correction for their intermediate and near visual needs.
Patients may choose to replace the natural lens with an accommodating intraocular lens. Like the natural lens, the Crystalens creates accommodation from distance to near vision by moving along the visual axis. Both the original crystalline lens and the Crystalens also arch or change their radius of curvature to increase their accommodation. They both move anteriorly and flex or arch to increase their focusing power in the intermediate and near ranges. We can now bridge the generation gap with accommodating lenses. They allow us to restore the near and intermediate vision of our middle adulthood.
I trust you have found this video to be helpful and informative. I have been confidently implanting this lens for a significant amount of time, and my Crystalens patients represent many of the happiest patients in my practice. I am dedicated to helping you achieve your best visual outcomes so that you too can experience crystal clear vision again. Should you require further information to help you better understand the options available to you, please feel free to ask me or any of our wonderful staff here at the Katzen Eye Group. Thank you.